All praises to the Most High.
Yeah, all praise be to the Most High. Thank you for doing the work. We really appreciate you, and everybody just take this information and really use it and spread the news. Thank you.
All right, brother. All right, so that answers that question. It leaves the line open. If you unmute your microphone by pressing your star key 2 times, we will address what you want to talk about. We want to talk about natural remedies. Please open your mic by pressing your star key 2 times. We'll answer your question as we move on, because we still have one more topic. Unless you've got a question, no more questions here, there, or anywhere. Okay, so now let's talk about tinnitus, ringing of the ears, because we talked about Parkinson's, we talked about ulcers, we haven't talked about tinnitus. Let's talk about tinnitus. Let's see what the latest is. Tinnitus. Okay. Natural. REMEDIES. And we'll see what people know. We'll see what they know. All right, let's go there. So let me get a credible source. There's a good one. And let's bring this report about tinnitus. Let's talk about and let's discover a good source of information here regarding the natural tinnitus treatment methods to stop ringing in the ears. Do you ever get ringing in the ears? Worse yet, does it happen often? There's a chance you have tinnitus if that's happening. But all hope is not lost, as there are natural tinnitus treatment options out there. In 2014, a report was published in the journal Frontiers in Neurology, and it states tinnitus is one of the most common somatic symptoms to affect humanity. In Latin, tinere means to ring. What is tinnitus exactly? And might it be the cause for strange sounds or sensations you're experiencing in your ears? Most experts refer to tinnitus as the condition that causes ringing in the ears. However, other abnormal sounds and sensations can also be attributed to tinnitus. The definition of tinnitus is the perception of noise or ringing in the ears. That's the definition of tinnitus. Some also describe tinnitus as the condition as hearing sounds in the ears when no external sound is really present. Although tinnitus is only a significant problem for about 1%, up to 5% of the population, 1 to 5%, but up to 10% to 15% of all children and adults are believed to experience ringing in the ears from time to time. So really, tinnitus really only affects 1 to 5%, but 10 to 15% are getting periodic ringing in the ears from time to time. That's a lot. 10 to 15% of everybody, that's a lot of people. According to the American Tinnitus Association, this complex audiological and neurological condition is experienced by nearly 50 million Americans, older adults, men usually, people who smoke or use drugs, and those with a history of ear infections or heart disease, cardiovascular disease, have the highest risk for developing tinnitus. Most experts believe that it's not a disorder itself, but rather one symptom of another underlying disorder that affects the auditory sensations and nerves near the ears. However, there are tinnitus treatment options that are out there to treat these symptoms. Let's talk about it. For many people, tinnitus symptoms come on gradually and eventually go away as the brain and ears adjust. However, for others, tinnitus can last for years, can go on for years, and cause various complications. Tinnitus. A high percentage of people with tinnitus that's persistent and untreatable go on to also develop anxiety or depression as a result. So then you're not treating just tinnitus. You're treating anxiety and depression. There's a whole other report on that up on herbalhealthreview.com under common conditions. A whole other report on anxiety and depression. It's under A. So what types of things can you do to deal with lower tinnitus, to lower the tinnitus symptoms? What can you do? Tinnitus treatment includes avoiding excessive loud noises of noise pollution. Using certain hearing aids can prevent it and stop it. Certain hearing aids. Noise pollution, get rid of it. Don't get rid of the noise pollution. And preventing ear infections. And avoiding drug use. Those all help when there's tinnitus. Let's look at a natural treatment for tinnitus. Most cases of tinnitus are unfortunately thought to be difficult to treat. And sometimes severe tinnitus cannot be treated at all when permanent and irreversible damage to the ears or nerves has occurred. That being said, many patients find natural tinnitus treatment methods and coping strategies to be very helpful in allowing them to adjust to changes that tinnitus brings. Here are six tinnitus treatment options. Let's look at them. Counseling and coping strategies and education. You really need to know about that. Experts recommend that patients with severe tinnitus become educated about tinnitus and how they can best deal with the symptoms. This can include learning about biofeedback in order to control stress and a reaction to tinnitus sounds. Talking with a counselor or joining a support group who are with people who are dealing with tinnitus. Coping with strategies are most useful for managing emotional side effects of tinnitus, such as anxiety, trouble sleeping, lack of focus, and depression. Some patients choose to get involved in tinnitus retraining, which involves wearing a device in the ears that provides soothing music or noise, along with the undergoing counseling. The goal is to help your body and brain learn to get accustomed to tinnitus noise, which reduces your negative reactions to the unwanted sounds. Support and counseling during the process can be helpful for reducing anxiety. Researchers are now, they're more about the benefits of coherent cognitive behavioral therapy, interventions to help treat the distress associated with tinnitus. So that's number one. Number two, masking devices. Masking devices and hearing aids can serve as sound therapies and be useful to dull the intensity of unwanted sounds or to increase volume of soft environmental sounds which drown out the nagging tinnitus noise. Some people choose to use a white noise machine and apps to their telephones or videos on their computers to help them sleep, relax, or concentrate. There are also now electronic devices available that can help suppress unwanted noise and help with tinnitus treatment. Devices for tinnitus treatment to improve hearing and lower disturbing sounds include white noise machines or sleep machines, masking devices that are worn in the ears, similar to earplugs or hearing aids, certain hearing aids, which your doctor can recommend and custom fit to your ears. Free applications, free apps on your phone that can play soothing sounds such as falling rain, forests, and ocean waves. These can also work as natural sleep aids to improve sleep when you're feeling anxious, using natural sources of light, of light noise, such as fans, humidifiers, using these natural sources of light noise, such as fans, humidifiers, dehumidifiers, and air conditioners are all helpful. And you can avoid, and number three, avoid very loud noises. It's been found that exposure to loud noises can contribute to early hearing loss and ear problems. Loud sounds can include those from heavy machinery or construction equipment, such as sledgehammers and chainsaws and firearms. Even gunshots, car accidents, or very loud concerts can and events like that contribute. They can trigger acute tinnitus. All this should go away within a couple of days in some cases. Sounds of less than 75 decibels, even after long exposure, are unlikely to cause hearing problems or tinnitus. But those above 85 decibels can cause hearing loss and ear problems. To give you an idea of how loud this is, a refrigerator is about 45 decibels, while a gunshot is about 150 decibels. Technology and portable music devices also contribute to noise pollution, especially to younger people. So keep the volume of your phone, your MP3 players and MP4 players and iPods on the lower end when listening to headphones. And don't play very loud noises for long durations of time to avoid tinnitus. To avoid tinnitus treatment, look out for changes in your ability to hear. If you're frequently exposed to loud noises, limit the use of headphones or consider wearing earplugs. Tinnitus. The symptoms and classifications. Symptoms: hearing phantom sounds when no sound is actually coming from any outside source. any outside source. Sounds can include ringing, clicking, sizzling, buzzing, hissing, humming, and roaring. Sounds change in terms. Sounds change in terms which ear they come from, their intensity, pitch, onset, and volume and type. And sounds can stop and go, sometimes be soft and slow, and other times become louder and faster. Tinnitus sounds might only come from one ear at a time, unilateral, or both ears, which is bilateral. Feel very disturbed from their symptoms and facing psychological and mood-related problems as a side effect. Interference with your ability to concentrate or hear actual sounds, causing brain fog, confusion, trouble focusing, problems with speech, and especially in children. And number 4, don't use Q-tips in your ear. Many people try to clean out natural earwax from their ears with a Q-tip, but this can actually contribute to earwax blockages and ear infections and ear damage. Earwax protects your ear canal by trapping dirt and bacteria, so allow it to do its job. To avoid irritation or damaging the inside of the ear, don't stick anything inside your ear canal. This can actually make tinnitus treatment more difficult. If you have excessive earwax, talk to your doctor about safely removing it so earwax doesn't accumulate and become too hard to wash itself away and naturally. Avoid overly using prescription drugs and alcohol. Research shows that some medications and drugs and even over-the-counter painkillers can make tinnitus worse. Using recreational drugs, especially when pregnant, which can damage the fetus's nerves. Smoking and drinking too much alcohol are also tied to tinnitus. Talking to your doctor about changing your medication, lowering your dose, or finding another way to manage any conditions you might have. Medications that contribute to ear damage can cause tinnitus include antibiotics, polymyxin B, and erythromycin, vicomycin, neomycin, cancer medications, mechloroethamine, and vincristine, and diuretics, bumetanide, urochronic acid, or furosemide, quinine medications, some antidepressants, aspirin, when taken in high doses, usually 12 or more a day, can cause tinnitus. Reduce inflammation and chronic stress. Stress and high levels of inflammation both seem to raise the risk of ear problems, including ear infections, hearing loss, and vertigo. And on top of that, stress can make tinnitus symptoms worse by changing how your brain reacts to noises it hears. Research regarding cognitive behavior therapy for tinnitus shows that tolerance to tinnitus can be facilitated by reducing levels of autonomic nervous system arousal, changing the emotional meaning of the tinnitus, and reducing the stressors. It's been found that there's even some overlap in anxiety and tinnitus due to an association between subcortical brain networks involved in hearing sounds, attention, stress, and memory functions. A poor diet, sedentary lifestyle, lack of sleep, chronic stress are all capable of reducing immunity and making you susceptible to nerve damage, allergies, and ear problems. And if you frequently experience seasonal and food allergies, it might affect your ears, ear infections, swelling, and other problems related to damage of the vestibular system. Consider changing your diet. Go on that Make Lifestyle Changes diet. Get exercise and routine, an exercise routine and ways of dealing with stress, which in turn will aid your tinnitus treatment. Try natural stress relievers like exercising, yoga, prayer, meditation, taking warm baths, using essential oils, and spending more time outdoors and eat an anti-inflammatory diet. Some of the most common signs of tinnitus include hearing phantom sounds, which no sound is actually coming from or any outside source. Sounds include ringing, clicking, sizzling, buzzing, and hissing, and humming and roaring. Tinnitus sounds are commonly described by patients as being like the sounds of escaping air, heartbeat, breathing, or the inside of a whirling seashell. Many people report that the sounds change in terms of which they hear, which ear. The sounds keep changing in terms of which ear that they come from, and their intensity and pitch, and onset, volume, and type. Sounds can stop and go and come and sometimes be soft and slow, or other times become louder and faster. Tinnitus sounds may only come from one ear at a time, unilateral, or from both ears, bilateral, and rarely also possible hear music sounds or voices, although the underlying cause of this experience can include more psychological problems and even drug use. It goes on and on. There's lots of information about tinnitus, and I can send you a copy of this report. And you know that there is a lot of information about this. Again, this report, it goes on with a lot of information. So call me 503-362-5899. I'll send you a copy of this report, 503-362-5899. Also, if you'd like me to be your coach to help you through any health disorder, call me, 503-362-5899. My email address is Truman@herbalhealthreview.com. Truman, Truman, @herbalhealthreview.com. There's a lot more information about tinnitus. I'd like to make sure you get it, and that you are doing something about it, because there are a lot of things we can do about it, and we didn't get a chance to get into that much. But give me a call. I'll make sure you get a copy of this report. And right now we need to get to Prophet Elijah to give us a closing prayer as we close this broadcast. Thank you for listening. I hope you make a donation so that I can continue to do these broadcasts. Please consider a donation. I appreciate it. Let's get over to Prophet Elijah so we can get that closing prayer and close down this broadcast for now. And we'll see you next week. Be sure and tell a friend, and be sure and make that donation. Prophet Elijah, are you there, Prophet Elijah?
Yes, I'm here.
We addressed all the issues as much as we could, the time allowed. Please, sir, give us one of your wonderful closing prayers.
Yes, sir. In Luke 5:36 and 38, and Isaiah 65 and 8, Yeshua, he spake also a parable unto them. No man put a piece of new garment upon an old. If otherwise, then both the new maketh rent and the pieces that was taken out of the new agreed not with the old. And no man putteth new wine in old bottles, else the new wine will burst the bottles and be spilled, and the bottles shall perish. But new wine must be put into new bottles, and both are preserved. Thus saith the Most High, as the new wine is found in the cluster, and one says, destroy it not, for a blessing is in it. So will my servant say, that I may not destroy them all. Tonight, I beseech you to embrace the new, releasing the old wine skin that would bring resistance to change. Forgive us, Abba Father, for failure to align ourselves perfectly with your will, knowing sin and rebellion, emotional stress and trauma, submission to an unholy cover, inherited curses and unforgiveness, or lack of separation from things of the world. We ask for forgiveness for not taking better care of this temple that was a gift to us. Forgive us for giving better care to our automobiles and houses and material things rather than to this awesome body that is made in your image and likeness. Tonight, all the listeners and I close doors to Satan, break curses, renounce psychic bondage, cut evil soul ties, loose the mind, restore the fragmented soul, confess sins of the Father, surrender to Yeshua, and renounce all evil in our lives. We command the return of the curses of demons and sickness and disease back to the sender. Tonight, we use our weapons against the kingdom of darkness. Satan, we are closing every door that you may have opened in us from evil contact. We break the curses back to Adam and Eve and destroy legal holes and grounds that the demons have to work in our lives. We bind the spirit's power and loose ourselves from their holds. We break demonic soul tie. We ask for the necessary spiritual gifts, and especially the gift of discernment. We ask for the anointing of the Holy Spirit and the authority of Yeshua Christ. We have been given power and authority over Satan and his army. Those who seek you will not lack any good thing. You are the Ahia of restoration. You will restore what the cankerworms has eaten up. You will restore our soul. Thus said the Most High, Dr. Berst and Dr. Myers, great reward awaits those who have been unwavering and diligent to do all that I ask. I call you good and faithful servants, and it is time to reap the benefits of your service. What you have done in secret will be rewarded openly, says the Most High. Well done, according to Matthew 25 and 21. His Lord said to him, well done, good and faithful servant. You are faithful over a few things. I will make you ruler over many things. Enter into the joy of your Abba Father. The words of your mouth are the words that are creative and bring life to all who hear them. You have been fully anointed to be used as a co-healer, with Yeshua being the healer, bringing life to all who hear them. You are generals with the highest ranking in the most highest honor. My prayer for you is when you pray, demons tremble and cannot remain in your presence, for you have become a pure terror and dread to the enemy's camp. Demonic spirits run and approach and do not manifest in your presence. The resurrection power of Christ resides in you. Signs and wonders will follow you for all the good that you do. So I pray that you are filled with the helpful workness of the word tonight. I pray that you find help and to reorganize your thoughts, intentions, and course of action to accommodate the embrace the new that you have not considered. So, Father, I thank you tonight as we close. We thank you that the anointing has been released tonight, and I thank you that the love of Ahia is shed abroad on all the hearts and minds of those who were listening tonight. We give you all praise, all glory, in the name of Yeshua Christ. Shalom.
So be it. In the name of Yeshua, so be it. Amen. Well, my goodness, let us open the microphones that we might all praise the Most High together. And please tell a friend next week to join you. And we'll see you next week on Discoveries in Health.